If you are taking an opioid for chronic pain, you may be wondering, can I stop taking it? Do I still need this medication? Is there anything to avoid withdrawal symptoms? What if my pain comes back when I stop? These are valid questions and concerns that many people taking opioids for chronic pain have. Over the past 12 years, I have helped many patients who were taking opioids for years to reduce the dose, to stop entirely, or to switch to a different but safer opioid. Watch this video to the end, as I have some tips for you to have a successful taper. So let's talk about opioid tapering today. Opioids are the most potent painkillers. Our body produces our endogenous opioids. These are endorphins, enkephalins, and dynorphins. Morphine and codeine are found in nature, in the poppy plant, while other opioids are made in a laboratory. Oxycodone, fentanyl, hydromorphone, tramadol, etc. When we take opioids, they activate receptors in our body. The receptors mu, delta, and kappa receptors. The more opioids we take, the body starts multiplying the amount of these receptors in our body. If these receptors become empty, they crave the opioid, and the person will have very characteristic symptoms of withdrawals. This can be very intense and uncomfortable. Here is a list of opioid withdrawal symptoms: stuffed nose, diarrhea, abdominal cramps, headache, sweats, agitation, insomnia, muscle aches. So for a person who takes opioid every day, stopping or reducing the dose may trigger withdrawal symptoms. They feel pain all over their body, and it's very confusing with their original pain that they started taking the opioids for. It is hard to know, is it my original pain or is it the pain from withdrawal? It is very hard to distinguish these two. So, how would someone go to reduce the opioid dose safely without having to endure withdrawals? I'll explain to you how I do it with my own patients. Before I continue, let me remind you that this video is not intended to replace medical advice. If you have a condition that needs medical advice, please talk to your doctor. This video is for educational purposes only. If there is an emergency, please go to the nearest emergency department or call an ambulance. If you feel comfortable, talk to your doctor about your plan to lower the dose. Ask about the possibility of coming back to the original dose if tapering plan doesn't work. Ask for support related to how to manage the withdrawal symptoms if they are too strong. Talk to your pharmacist. They are very knowledgeable about strategies to minimize withdrawal symptoms. For example, if you have stomach cramps, abdominal cramps, they can orient you to buy some over-the-counter antispasmodic. If you have nausea and vomiting, they can help you with ginger or other over-the-counter anti-nausea medications. If you have headaches, they can show you some OTC painkillers. If you have insomnia, they can guide you about melatonin, magnesium, supplements, or sleep positions. Ask your doctor or your pharmacist to calculate your total daily dose in terms of morphine equivalents. So, if you take only morphine, just add all of the milligrams that you take in one day. But if you take a weaker opioid like codeine or tramadol, you need to calculate that in morphine equivalents. For example, 200 milligrams of codeine or tramadol is equivalent to 30 milligrams of morphine. If you take stronger opioids like oxycodone or hydromorphone, the number of milligrams will be less than morphine. For example, 80 milligrams of oxycodone is equivalent to 120 milligrams of morphine. And 12 milligrams of hydromorphone is equivalent to 60 milligrams of morphine. If you take various types of opioids, you need to add them all up. So, once you know the total amount of opioids you take per day in morphine equivalents, we can start a tapering plan. I recommend the first cut to be approximately 10% of the total daily dose. So if you were taking 90 milligrams total in morphine equivalents, you may reduce to approximately 80 milligrams per day. And I recommend to stay in this dose for about 2 to 4 weeks. Maybe in the first day your body will have some withdrawals, but soon it will adjust to the new dose of 80 milligrams total per day. Then you can take another 10%, reducing to approximately 70 to 72 milligrams of morphine equivalent per day. And you keep doing this reduction every 2 to 4 weeks until you reach the desired destiny. Here are some tips for you to have a successful taper. Focus on your function, not your pain. Go for a walk, do some activity you enjoy, and practice something that you are good at, like playing an instrument, cooking, gardening, or painting. If you need to pause the tapering for a few weeks, there are some external circumstances or something out of your control in your life. Take a pause and come back to the tapering plan later. Learn more about opioids. Read posts, watch videos, listen to podcasts, talk to other people who are able to taper their opioids successfully. Avoid contact and conversations with people who are not supportive of your desires to taper your opioids. Do not feel that you are a failure if you are not able to reduce the dose. Some people need more time, or they need to do this at another period of their lives. You may want to reconsider tapering at a later date. Do not try to change other medications at the same time. Keep the other medications the same and only work on reducing the opioid dose. Avoid using alcohol to manage withdrawal symptoms. Use other tools in your toolbox to manage your pain, like exercises, breathing, meditation. Drink more water and eat nutritious meals. And schedule some fun every day. I prepared a handout with this summary here. You can download this handout on this link. You can also find the link in the description of this video below. Here are some things that you may feel during the opioid taper. You are less bloated and less constipated. You are more alert and your thinking is clear. You are less fatigued. Your pain is the same, or is it better than when you were taking on opioids? And here, there are some situations where it is dangerous to taper opioids, and you should talk to your doctor if this is your case. If you have a coronary artery disease, if you're pregnant, if you have a severe mental disorder, or if you have an opioid use disorder, also known as addiction to the opioid. I hope you find this helpful. You may watch my other video here to learn about exercises, nutrition, and relaxation. Goodbye!